Hi, everybody. Governor Roy Cooper here. We have a debt of gratitude to our veterans who have fought for our freedom and safety abroad. You and your families have made tremendous sacrifices to give my family and me freedom and the growth. It is the most very friendly state with almost 800 of our state home. When veterans leave active service, it's our obligation to civilian careers and get access to the right. I established the governor's work on veterans focus on education, health and wellness, as well as legal and financial services for our veterans. We're committed to continuing to ensure that our state is a great place for military families to live and work. Veterans are forever grateful. Welcome.
Welcome home, warrior. With so many options, it can be overwhelming sorting through what resources and benefits you may qualify for. NC Serves is there to help you navigate every step of the way and connect you with everything you have earned through your service to our nation. Our Veteran Resource Guide has over 200 pages of federal, state, local, and nonprofit programs to assist you and your family.
Because of technology, we're all just bombarded with endless information. You can Google something for veteran services, and it's just mind-boggling. And people are busy. They're going to work, they're going to school, they're raising a family, they're trying to do their hobbies, they're trying to have a good work-life balance, and they're trying to navigate a resource, and they get frustrated and often give up. So when you have a central point like NC Serves, you come in and say, I have been very frustrated getting connected to this particular resource. Our community coordinator will say, understand, what do you need, and we're going to get you there, and we're going to streamline it. When you walk in our doors or get connected to us virtually, we can get you all your services, and we're going to be honest with you about what services you can and cannot get, what you're eligible for, and maybe you're not qualified for that service. But our main services: housing, shelter, employment, benefits, navigation, social enrichment, legal, substance abuse, counseling, mental health, physical health, you name it, and we're going to find it. And if you don't think anybody can help you, I actually ask, please ask us. You don't know until you ask and until we've navigated through the community. And if it's a need that's not being met, we want to know that. Our partners are amazing. They'll come together and say, we're going to find a way to meet that need. Never underestimate just how committed communities are to taking care of veterans and their families. Not handouts, taking care of them. Giving them great employment opportunities, affordable housing opportunities, access to good medical care, those quality of life issues, those needs that everyone wants. I was surprised just how robust it really is. And then when you ask a community partner, most of the time they say, yes, let's help, let's partner. You may land a good job, but after a while, you're missing what got put into you, which is this sense of mission. And then your purpose. It's like, well, I have a good job, but I don't feel that same purpose anymore. And even veteran spouses will tell us that. Getting connected to us, we'll get those social connections to where if you want to volunteer, great. If you just want to get on a in-person or a virtual coffee, we have all those options to where you kind of get that purpose again when you come back into the community. And you get connected with fellow veterans, and it's often people you knew and even served with. It's a small military in the grand scheme of things, and that sense of connectedness is what we want you to have. I love this because the community has come together. This work is hard. It's tough. It's tough on us. We focus a lot on self-care and taking care of our local team at NC Serves, but also our providers. But at the end of the day, we can say, hey, we made this community better, one veteran at a time.
Welcome home, warrior. Your service to our country came with great sacrifice and quite a few benefits. The Veterans Benefits Administration and our network of state and county veteran service officers across North Carolina are ready to help you identify and file for all the benefits you may qualify for.
Veterans, or rather soldiers, men and women, we're not accustomed to asking for help. We just jump in and do it. However, that could be a barrier for you coming into the office. We want you to come into the office today to assess just what's going on with you. We want to take care of you now.
The VA Regional Office assists veterans transition from military to civilian life. We assist with disability compensation, pension, education, veteran readiness and employment, and home loans.
Some services that a lot of veterans don't think of are the women health. I'm very proud that in 2014 that they're open an office specifically for us women in our health issues, because we too do serve this country.
I'm most proud of assisting veterans that live within our community. These are our store clerks, our postmen, the people that we interact with every day, and we assist them to help better improve their quality of life.
For the veteran that is just transitioning out of the military today, we would like to meet them where they are. However, for that veteran that have been out for a number of years, we would also like to explain and or get him or her into the office for those benefits he or she has earned.
One of the biggest challenges is that the VA system is quite confusing because we have so many benefits to offer, which makes it overwhelming to decide. You can meet with us and we could help navigate through those and see what you're eligible for.
Please visit one of our offices because you have earned these benefits. If I had to give a veteran any advice, one thing would be to register at the nearest veteran healthcare facility or seek medical attention through your private provider. Transitioning from military to civilian life is very tough. Please allow us to service you as you have served and protected this country.
Welcome home, warrior. For many service members, continuing their education is at the top of their list. When separating from the military, you may have questions about higher education. How do I find the right school? How do I pay for school? What about my GI Bill? Here in North Carolina, you have many options, many of which can be found in our Veteran Resource Guide. Our friends throughout the UNC system, our community colleges, and private universities are waiting to help you make your next chapter a successful one.
Walking in the doors can be pretty daunting, especially as you look at that transition process. So Daniel and I, both going through the transition process ourselves, understand firsthand, some of those challenges, and they're hard to navigate. So starting at a university, it's who do I talk to, where do I go? That is why we exist. We're here as kind of that case manager, that first line of contact for them. So veterans, being a non-traditional group by nature, they have unique experiences. So I think maturity goes along with that, and it's not just an age thing, but it's an experience thing. So they're more worldly in their views. They have families, a lot of them. They live in homes, they have mortgages, they have full-time jobs. So the way in which we serve our veterans and the military families, it's going to be much different than what it looks like for a traditional student here at the campus.
Here at NC State, I work with our Veterans Education Office. Primarily here, we kind of are the administrative arm of really supporting our students on campus, meaning we can help our military-connected students with military withdrawals, advising questions, registration questions, GI Bill benefits. So if they're using benefits, we can assist them through the enrollment process and receiving those awards that way. And that's really what our focus is to kind of really support them holistically through an administrative process.
Veterans that come to Wake Tech find a place at the center where they can chill. They can meet like-minded veterans, they can discuss their concerns, they can receive assistance if needed, and then they can be successful in what they want to pursue. We are here with a veteran zone so that they can come in and talk to some of their fellow veterans. They can learn about all of the programs that we have. We have Student Veterans of America Club. We have a Salute, it's a Veterans Honor Society, and we're here to help them be successful, but also that they can be with a group that they can relate with.
The Veteran Zone is where it's at. I mean, because it's as real as you can be in there. You're surrounded by a bunch of combat veterans. We all done the same thing. We get each other. I was lost when I first got here. I was scared, and this is where my place of comfort was to be around other like-minded people.
I think important to us is treating every veteran and service member and family member separately. They're individuals. While each of them do have common transitional challenges, they're all unique in terms of what they're going through, and if we treat them that way, then they're going to respect that, and they're going to reach out for it.
Welcome home, warrior. What's my next career? Upon entering civilian life, it may be difficult to figure out what's the next chapter of your career should look like. Workforce Solutions and NC4Me have a wealth of resources to get you the tools, the training, and information you need to find a new career with purpose and potential. Employers across the state of North Carolina are eager to hire our veterans.
I believe that if you have served this country, you can certainly serve in any company in this country. NC4Me understands that it's difficult to transition out of the military into a career in the civilian workforce, so we have created NC4Me to make that transition easier. We are going to allow any of our veterans, our Guard and Reservists, our spouses, and our transitioning service members to connect to companies across North Carolina by simply putting their information into our Career Connection tool. NC4Me employs a team of individuals that are veterans, that are military spouses, so they understand what you've done in the military, they understand the sacrifice that you have made, and they're really educating employers on the value proposition of what the value really is with military talent.
We are North Carolina Career Center. In general, we provide a variety of services: employment services, career assessments, assistance with resume, assistance with workshops, and any of the employment services that we have to offer.
A lot of veterans don't seek help. And I think by having an organization like NC Works and Career Center with all the programs, it's another outlet to help them. A lot of times it's easier to blame somebody for your mistakes, and it's kind of hard for you when you're blaming so many people to, like, you know what, hey, I need to take a step back and look at myself in the mirror and seek out that assistance. And I think by, this organization, it's the gateway. It's just, it opens up the doors. Hey, here are some things that we can do for you. If we can't do these, then here go other avenues and other resources that we can provide for you.
We have a team of individuals that understand you, that are veterans, that are military spouses, that help create that connection with employers across the state. So we make sure you're taken care of from the minute you come into our organization and working with us to the minute you exit, and hopefully grab that career that you're going to love for the rest of your life. North Carolina believes that if we trusted you with our country, we can certainly trust you with jobs across our state.
Come home, warrior. North Carolina is fortunate to have 4 VA medical centers, over 24 VA clinics, 6 vet centers, and many state and community partners available to assist you with medical care that you are entitled to for your service to our nation. Don't hesitate to reach out. They're all there to support you.
The state of North Carolina is committed to being the most veteran state in the U.S. Veterans who live in North Carolina may be eligible for care from the Veterans Health Administration, from VA or from some combination. If someone is enrolled in VA healthcare, they should get primary care services, and the primary care doctor can then help them figure out if they need access to specialists. I think one thing that younger veterans don't realize is that they are as eligible for health care as some of the older veterans or those that they've seen that are suffering from physical wounds of war. There are also the invisible wounds of war. One of the things that veterans should think about is the toll that service has taken on them psychologically, and whether that's something that needs to be investigated.
Here at the Vet Center, we do individual counseling, we do marriage counseling, family counseling, and we do. When a veteran gets out of the military, there's a lot of difficulty transitioning from being a veteran to being a civilian. The Vet Center can walk you through that process and get you to where you need to be. Not only do we serve veterans, but we serve active military, including Guard and the Reserves, as well as their families. And one of the new services that the Vet Center offers is bereavement counseling for family members of anybody who's died while serving on active duty.
One of the hallmarks of the VA is that primary care serves as the anchor for the whole system. If a veteran seeks health care at the VA, they will be assigned a primary care provider who will perform a comprehensive assessment and get them connected to the resources that match their needs. Behavioral health care is now integrated into primary care.
At the Stephen A. Cohen Clinic here in Fayetteville, we service post 9/11 veterans, active duty service members with a TRICARE referral, Guardsmen, reservists, and their family members, all regardless of role or discharge status. If they've worn that uniform for more than a day, they're definitely welcome to our care. As soon as they walk through the door, they've made the first step towards their mental health issues. Here at the Cohen Clinic, our clinicians provide brief evidence-based, client-centered therapy all on an outpatient basis, as well as we provide case management services and resource referrals for things that are like finances, education, housing, and as well some of our clinics do provide transportation to and from the clinics within a 30-mile radius. We also provide child daycare in certain clinics.
It shouldn't matter whether a veteran lives close to a VA hospital or a VA clinic, or whether they live in rural parts of the state. They deserve and are entitled to excellent health care. A lot of new technologies have come into play so that veterans can access care through their home.
The Cohen Veteran Network, or CVN, telehealth video therapy is what we use. It essentially creates our clinic becoming a clinic without walls. This allows our clients to be able to receive care right from the comforts of their own couch without having to leave their own home.
It's important for veterans to remember that they serve their country
We have 1 minute
with
and 30
distinction.
seconds until we start. Please
No matter
find your
which
seats.
era they served in, what branch they served in, or what their role was when they were active duty. Healthcare benefits are important and will partner with you in your journey.
Terry Westbrook. All right, thank you everyone. Good afternoon and welcome to our final Governor's Working Group for 2022. We've had a very exciting day because all the chairs from the Community Veterans Engagement Boards from across the state came and met today in Raleigh before we came here. So we're feeling a lot of energy and we're excited to have you with us today. All right, first up, we have Secretary Walter Gaskin with the Department of Military and Veterans Affairs. Secretary Gaskin, welcome.
Thank you very much. Glad to be here today, and of course, you heard that this is our last one of the year, our last formal one. We will be engaging in the different committees to do forth the great work that the working group does. I'd like to thank everybody that are here, and of course, all of our co-chairs that are here on the panel. And we got a very interesting program. And with that, we'll start with the reports, and introduce Assistant Secretary Terry Westbrook.
All right, good afternoon. Thanks everybody for coming. I appreciate all the turnout. I see a lot of folks Vicki Adamson, County Commissioners, I love it. Ellery Smith, longtime friend of the Governor's Working Group. There's a lot of folks out here. I really appreciate the turnout, and I appreciate the interest in the Governor's Working Group and the work we're doing. So what's happening right now? Where'd he go? Okay, we'll go to that one. Okay, so first off, disregard the first statement. I'm sorry. Obviously, the Governor had to reschedule his plans for this, and we're going to figure out when that's going to be. But we're going to get all that together on that. Victor Kozinski, and I'm sorry, sir, but their national chairman over here, they're here from the National American Veterans Association, AMVETS. They'll be making a presentation here in a little bit, but thank you very much for being here. Veterans Day. I know what I'm doing for Veterans Day. I have about 4 or 5 different Veterans Days events over the next week or so after that I'm participating in. Most of our department is participating in a lot of stuff, border to border. Everything from parades in Asheville to Morehead City to Fayetteville, Virginia border. So there's lots of Veterans Day events all over the state. I encourage everybody to turn out for that Veterans Day event, show your support for the concept. In conjunction with that, the Operation Greenlight, which everybody's heard about Operation Greenlight. We're getting a lot of momentum about it. A lot of organizations and local governments and the state government and nonprofit groups and service organizations are all participating, even down to individuals at their home, the green light on the front porch. So I encourage all of you, green light on the front porch, show your support for all of this. The National Christmas Tree Tour, as everybody knows, the White House gets a Christmas tree every year. They go to different parts of the country to get their Christmas tree. This year it's coming from North Carolina. And in conjunction with its trip from the farm to the White House, it's making various stops around the state and around Virginia on its way to Washington, D.C. It's stopping at the Kinston, North Carolina State Veterans Home on Veterans Day. So great timing, great event. The administrator for that facility is here. She's planned an incredible program for that stop and the publicizing of it. And it's really going to be a fun event for Veterans Day, and we're all looking forward to it in the department. And anybody that's looking for something to do other than their local community, please come to Kinston and let's do out there with what we can. We met at lunchtime. Paul Berry put this together. A lot of the service organizations, we have 6 functional community veteran engagement boards around the state of North Carolina right now, all the way from the western part of the state, out in the Asheville area, all the way to Greenville and Fayetteville, Raleigh, Charlotte, various places, the Triad. Every one of those organizations had a representative at the luncheon we just had, discussing particularly how we make community veteran engagement boards operate and generate the interest and the issue resolution and all that stuff that we want to do to make North Carolina's veteran services as good as it can be. So I really appreciate everybody that made the trip into town and participated in this kind of this informal roundtable that we did, and it's going to lead to a configuration of how we think we can support them best and how they can provide all of the input that we could possibly want to improve our veteran services. So thank you again for all of that. Our North Carolina State Veteran Homes, we have one that's over 30 years old, one that's over 20 years old, and a couple that are approaching 10 years old. And then we have a brand new one that we're trying to get open now. So saying all that to say, we always have renovation, restoration, minor construction, major construction projects associated with those facilities. And we're in the middle of those, everything from new roofs to new heating and air conditioning systems to additional storage capability, to new floors, to replacing furniture. There's all kinds of things that are associated in there. The North Carolina Department of Military and Veteran Affairs, through our use of the North Carolina State Veteran Home Trust Fund, are supporting all of these different issues and making sure that our homes stay current, as technologically advanced as available, and they provide the comfort they need to provide for the veterans that are admitted and residents of those homes. Legislative priorities. A lot of you have probably heard or seen some of what the department's planning on to go to the General Assembly in support of. We have a very robust ask that we're going to be working on. We would ask each of you to connect with your local representatives and talk to them about how the Department of Military and Veteran Affairs is attempting to meet the capacity requirements for outreach and for cemeteries and for providing veteran services, and the budget they're asking for that in support of meeting those capacity goals. Ask your local representatives to support our goals on that. We're going to be putting a lot of effort into letting the legislator know what we're trying to do and why we're trying to do it. We would really appreciate the support. I've talked about Operation Greenlight already a little bit. I won't spend any more, but other than to say this is something that's going to show that the state of North Carolina has a real interest in how veteran services happen and providing the best and most robust veteran service package that we can find. And this is really a demonstration of that. And everybody that participates, I hope you all feel the sense of accomplishment associated with what we're doing with that. So I thank you again. Takeaways. Number one, our homes, the state publishes their COVID-19 positivity rate all the time. They keep it current on their website. Our homes are consistently, significantly better than the state average. That's not saying the state average isn't good. It's just that our homes do an exceptional job of managing that transmission issue and taking care of those residents to the standard that we expect veterans to be taken care of in North Carolina. Stay vigilant. Wash your hands. Social distancing. All of those things are still relevant concepts and things that we want to encourage people to do. We know that we've changed some of our requirements as far as masking and stuff like that, but it's still incumbent on every individual person to really pay attention to your own issue. Make sure you take care of your health, and that's what we're talking about here. The subcommittees on the Governor Working Group, we'll be talking about them informally mostly today a lot. We have several of the committee chairmen here. I see Stephanie Young, who is our subcommittee chairman on health. I see Blake Bourne on social enrichment, Dave Roddenberry on social equity, Victor Glover, who's leaving us, that is our subcommittee on employment. We have some representatives from our homeless subcommittee, Crystal Miller, who our benefits subcommittee chairman. So all of our subcommittees are here. They're all have a lot of information about what their subcommittee's doing. And if you have any questions, we can direct you to who you need. If you want to get involved, if you want to be part of the process, or as I always say, part of the solution, not part of the problem, we can get that going for you. So, are there any questions? At this time, I will be followed by Mr. Paul Cruz, Director of the Veterans Integrated Service Network for the Mid-Atlantic region, which is our crowd. So, thank you.
Thank you, Terry. I appreciate it very much. And thank you all for being here. It's great to see the crowds getting bigger each time that we're here, so it's really good to see that. So I just want to go over a few things, some updates from the Veterans Health Administration this afternoon. First off, as you probably have heard about the PACT Act, and there are different areas of the PACT Act. You're going to hear a lot more from Mark in his presentation about toxic exposure. But one of the things that the PACT Act did as well is it helped the Veterans Administration with its capital campaign. Specifically, it authorized 31 new medical facilities across the nation. And for our VISN, it actually authorized 2 major facilities. They're going to be called specialty outpatient clinics. Specifically in North Carolina, that is the Fredericksburg Outpatient Clinic. It's going to be about a 250,000 square foot health outpatient clinic, providing multiple specialties, primary care, and mental health in the Jacksonville area. It is not, as you know, we do things very quickly in the government, especially the federal government. So it's not going to be open and seeing its first patient until 2027. So it sounds like a long way away when I think about it, but then I realize it's actually 5 years, and I don't know, that's not as bad as it could have been much further out. The other one, though, but just to let you know, is the Hampton Outpatient Clinic. So we're really putting out a lot of new health centers and not necessarily medical centers right now to try to make sure that we can get the care where our veterans need it. And a lot of our health care across the nation is really turning a lot more to ambulatory or outpatient services and not as much inpatient services. So we're looking forward to that. The next thing I want to talk to you about and just make you aware of is that we have a new secretary, Secretary Elna Hall, who was just I guess appointed probably about 3 or 4 months ago. And he set forth his 6 priorities for the VHA and for the enterprise. And I just want to make you aware of these and speak briefly about them. The very first priority is to hire faster and provide more competitively, be more competitively, basically. One of the things we're seeing, just like what's happening in the private sector, is we're seeing a lot of turnover in our staffing. A lot of folks healthcare professionals who have gone through the COVID pandemic have really had some second thoughts. And we're seeing a lot of folks that are leaving the healthcare, leaving inpatient care, leaving different sections. So what we are trying to do is, of course, hire faster. If any of y'all have ever applied for non-military, military is really quick to get you in, but for the federal government, it is a slow process, especially in the VHA, easily taking more than 6 months, sadly, sometimes. But we're shooting to make sure that that is under 90 days, and that's our target. So we're working through our systems to improve that speed of hiring. And secondly, making new options available to us through legislation in the PACT Act to hire more competitively. This is allowing us to provide different incentives for physicians and for nurses and other clinicians so that we can be competitive with our neighbors in the private sector. The next priority is to connect veterans to the soonest and best care. This is a bit of a change on our access standards that you used to hear us talk about in the past. But it's really making sure it's a more comprehensive look, not only working to be having the access within a reasonable time frame, but making sure that we have the capital aligned, our infrastructure aligned to be able to support that. And so that's what's helping us with these there's some new leasing authorities and such that are coming with the PACT Act as well that allow us to work with our community partners and our DoD partners to share resources. The third priority is serving veterans with toxic exposures. That is working with the PACT Act and employing the PACT Act. And I think you'll hear more about that from Mark, so I'm not going to steal his thunder. Our fourth is accelerating our journey to high reliability. The Department of Veteran Affairs a number of years ago began its journey to high reliability in search of zero harm to patients, making sure that our employees were in a safe environment where they could raise their hand if they saw something wrong, making sure that we were focusing on continuous improvement and always doing better, and making sure our leaders are engaged in excellence across their health systems. So this effort is really to push further on that to make sure that we are doing that every day in our facilities. The fifth priority is to support veterans' whole health, their caregivers, and survivors. This really does talk to our efforts and continued efforts to whole health, and what we mean by that is not just disease-specific care, but looking at each veteran in their whole body and well-being, so that we're focusing to make sure that they are successful in what they want to do in life as best as we can help them do that, and making the choices that are right for them. At the same time, it's looking at our caregiver support program and our survivor programs to ensure that those programs are getting the attention they need as we see the caregiver support program continually changing a little bit. And you'll hear me talk about some changes here in just a second. And lastly is our everlasting priority on preventing veteran suicide. I'm very happy to hear that today that folks are here from the Gillings School of Public Health that are working on just one of these types of programs that's here in the North Carolina area. We have several other efforts that are going on across the nation. We're putting more resources towards veteran outreach. The crisis line, I can't say it enough. It's now easy to remember the crisis line by just the basic 988 number. So those are the 6 priorities that I just want to make you aware of. These are the things that we're working on this year. I was not allowed to get out here in front of people without talking about the flu shot. How many of you have received your flu? No, you don't have to tell me that's a HIPAA violation probably, so I probably shouldn't ask that. But I'm hoping that you have gone out and gotten your flu shot. I got mine this year. It was, I guess, relatively innocuous based on our COVID shots that we've been getting. I felt pretty good through it. But we do see that flu is making a comeback, and it is showing up. We're taking our masks off. I think we had a reprieve from flu because we weren't wearing masks all the time, and as we take our masks off without being exposed for 2 years, now we're getting exposed. So we're seeing this flu, and it is showing up as well as some other things you're hearing in the media. So we really do want to encourage everyone to get their flu shot and to get their COVID boosters. There are different vaccine options. First off, Tara, who is, I know, somewhere in the virtual world watching this, she is really into the QR code. So if you have your phone out, you can actually go to this QR code that's being used across our medical centers and facilities and actually get a list to connect you up to the closest location for you to get a flu shot or to get your COVID vaccine. So just encourage that. The next, see, there's another QR code. The next is also to talk a little bit about some of the changes in the caregiver support program. If you remember that there are this group that was kind of an initial group of caregiver support came out that was the Legacy program, if you've heard that, where there was a period of time we thought we may be reassessing those legacy programs. Those have actually been now, it's been now determined that those are going to be extended for a 3-year period. So veterans can feel safe that if they were in that legacy program, they have a 3-year reprieve until that reevaluation may or may not occur again. However, the original rollout of the caregiver support program was only for veterans who were eligible after September 11th of 2001. The most recent change now takes us to open up eligibility for veterans who were after May 7th of 1975 and before September 11th of 2001. So it's really opening up the window from prior to from 9/11 all the way back to right after the Vietnam-ish era war or conflict. So if you know people that have been worried about where they are and the eligibility, I encourage them to reach out and look on va.gov, look at the caregiver support program, reach out to your social work program at your local medical centers for more information. And that brings me to the end of what I'm going to talk about, and so I will introduce my colleague, Mr. Mark Vilos.
Good afternoon, everybody. I know Paul's serious when he talks about flu shots. That was the first thing he asked me before I could sit down next to him. So I was no HIPAA violation there, I guess. But I have some updates for you today. It's great to be here this afternoon, and it's always great to talk to everybody here in person and everybody in the virtual world. I'm going to start out by talking about the PACT Act. That is the big, big gorilla that VBA is currently working on, making sure that we are ready to process those claims. Well over 100,000 claims have come in on the PACT Act so far, and we're expecting many, many, many more over the upcoming months. The biggest message that I can give to everybody is if you think you're eligible, if you are pretty sure you're eligible, if you have one of those disabilities that are claimed within the, or diseases or disabilities that are claimed in the PACT Act, file a claim. File it now. Don't wait. That's the most important thing. And I think that's the most important message that I would give to everybody out there, that even if it's not you, if you know somebody, a family, a friend, a neighbor, an acquaintance, somebody you're standing next to in the grocery store, talk about it, get them to file their claim. And why is it important that we file it sooner than later? The President signed the PACT Act back on August 10th of this year. In order to be eligible for a retroactive benefit, if you're found eligible for a service connection, you have to file within a year of when the President signed that bill. So you have until August 10th of 2023. You can still file after that, but you wouldn't necessarily be entitled to that retroactive benefit back to August 10th of 2022. So it's really, really important that you file now. And I will remind everybody that within the PACT Act, if you read through it, there's a phased-in approach that when Congress wrote it and the President signed it for different eligibilities, VA decided that we're going to start processing everything together. So although you may see some dates in there, everything is going to start to be processed. And the processing date that we're going to start this is January 1st of this upcoming year. It's really, really important that everybody files their claim as quickly as possible. You can see the website up there. I think next month I'll have somebody turn it into a QR code, but it's a website now. It is. Do you? Okay, good. We need that. If you go to va.gov/PACT, P-A-C-T, all the latest information is being put on there, and I encourage you to share that website with folks that you know. VBA is doing a lot to prepare to start processing these claims on January 1st. One of the big things that we're doing is we're creating a lot of automated support tools for our claims processors. This is going to assist them, allow them to be more efficient as they go through the process, and I think it's going to allow them to make decisions quicker, not just on PACT Act claims, but on other claims also, which will free up more time for working those claims. There's also a huge hiring blitz within VBA, and I encourage all of you, go on usajobs.gov. We have VSRs and RVSR positions. A lot of people are like, what's a VSR and an RVSR? A lot of people don't know. I'll kind of explain that in a minute. But we are looking to hire literally hundreds to thousands of folks in different positions over the upcoming year to make sure that we have the bandwidth, the employees to be able to process these claims. So, I encourage all of you out there, again, I'd say family, friends, acquaintances, the people in the grocery store that you meet, get them to file or get them to apply for jobs. There's obviously certain eligibility, but you'll see VSR and RVSR positions. Those are the folks that actually process the claims. Those are the folks that actually work the claims. They gather the information that we need to make decisions, and then they actually make those decisions. So these are highly technical positions. We do significant training. There are several months of training for folks. Encourage these folks to anybody that you know that might be eligible to apply. That's really, really important. We are every couple weeks we are bringing on quite a few people, at least in the local area that are covering North Carolina, but all over the country to be able to process these claims. So that's important. Just a couple. I'm not going to get into a lot of the details right now of the PACT Act, but a couple things to remember. The main part about it, and this is something again that I've heard over the past 5-6 years as I've talked around the state of North Carolina, is the burn pits, the environmental hazards in Southwest Asia, and the disabilities that resulted from that. I believe there are 31-ish disabilities ranging from respiratory conditions to cancers. So please be aware of that. Another big component of the PACT Act is hypertension related to Agent Orange or herbicide exposure. That's another one that I know a lot of the Vietnam era veterans have talked about, and is another big component of us being able to grant service connection. So again, there's also some components in there about additional locations that will allow us to grant presumptive service connection for both certain radiation diseases and Agent Orange related diseases. So there's other locations other than Vietnam, and that's important to be aware of. So that's my talk on the PACT Act today. You'll be, as we start up Governor's Working Group meetings back again in January, you'll be hearing me give more and more updates on different components of it. I want to just, not sure if we talked about this last month, but the regional office, which is located downtown Winston-Salem, now has free parking for veterans. They have to park in a certain parking lot. I think so the directions are up there. They are on our website, and take their ticket in, and we'll validate that ticket. If they come to the regional office to see anybody in VBA, whether it be a counselor, somebody in veteran readiness and employment, or if they come for a BVA hearing, sometimes veterans are on site for several hours when they come for a hearing. So we'll be able to validate those parking tickets, and they'll be able to park for free. So that's something that I think is really, really important. Our next Veterans Benefit Live event is located in Wilmington at the American Legion. We've done it there numerous times, November 17th through the 19th. That's a Thursday, Friday, and Saturday. And we will be there along with the American Legion, who's supported us immensely through this process, and we'll have a whole bunch of folks out there helping veterans. So please pass the word around about that event. It's going to be huge, just like it's been for several years, and we're excited about that. Next update I'll give you should have some information on some more events throughout 2023, but we're excited about that event. Last thing I wanted to mention was a little bit about our outreach plan and the focus that we're putting on getting out there and educating and getting veterans to apply for benefits. Many of you out there that have heard me speak in the past, 5-6 years ago, we did an analysis of how many veterans in the state of North Carolina were getting disability compensation and pension benefits. And it was 25% of all the veterans were getting that. That, according to me, was way too low, way too low. Some counties had veterans, only about 10-11% of the veterans in their counties receiving benefits, and there were only a handful that were receiving more than 50%. As you can see here, 69 counties of the 100 counties in North Carolina, 25% or less of the veterans in those counties were getting service-connected compensation or pension benefits. So we really, over the past 5 years, including the 2 years plus of the pandemic where we weren't physically there, really pushing to educate veterans, educate family, friends of veterans, to get them to apply if they have a disability that they believe was the result of their military service or started during their military service. A couple months ago, we started looking into, well, what progress did we make? What did we do? How successful were we? And I was thrilled to see. I really didn't know what we were going to find. I was sure hoping more folks were getting benefits, and we were thrilled to find out that 25% is now 40%. So 40% of the veterans in the state of North Carolina are now receiving a service-connected or a non-service-connected VA benefit. That is a huge input, a huge change. And if you look now, only 5 counties are in the state of North Carolina, out of our 100 counties, are there where there's only 25% or less of the veterans receiving benefits. So that's pretty big. And out of those 5 counties, they've all increased by a pretty significant amount. They just didn't get over 25%. So that's really some exciting news. Not that the work is done, and we can just go and pat ourselves on the back and walk away. There's still a lot of work to do. I still think 40% is too low, but it's a whole heck of a lot better than 25%. So we're excited about that. And the one thing that I would say about that is that's not just what me and my folks have done. That's a partnership. It's a partnership with our friends in VHA, with General Gaskin and the state, and all the state service officers, all the county service officers out there in every county across the state, the VSOs, the AMVETS, American Legion, DAV, all of these folks that help to serve veterans, and a lot of the veteran organizations out there, such as the Veterans Bridge Home and organizations like that, that really we partner with to make sure that we're providing a real good service to veterans and educating them and getting them the benefits that they've earned. So that's really some exciting news, and I'm going to continue to, for those of you that hear me speak over the next 12 months, you're going to hear the same thing over and over and over again. But I think it's some exciting news, and we've got to continue to get the word out about eligibility. And I know I'm probably way over my time, but one more thing that I want to say about that is this is really important because it's not just getting money to veterans. It's also opening up a whole lot of ancillary benefits or eligibility to benefits such as health care, things like that. So this is vital for us to be successful, and we all did a great job over the past several years in the state of North Carolina. And just some takeaways there. I don't think there's anything new on this slide. So next, I'm going to hand it over to Renee Rader.
One thing that I'd like you to add to the audience, what does presumptiveness mean?
Okay. Yeah. Okay.
Okay. All right. I think you heard me about presumptiveness.
Yeah. So one thing Secretary Gaskin asked me to talk a little bit about was presumptive, and yeah, he opened the doors, so now I'm going to talk. So I don't know what time it is here, but so normally when a veteran files a claim for a service-connected disability, they have to show that it incurred or started while they were on active duty, and it has to be shown in the records. So as an example, if you were in the military and you hurt your knee and you got treated for it and you filed a claim several years after you were discharged from the military, we're going to request your service records, and we're going to look in those service records and we're going to see, yep, Crystal was treated for a knee, so her current knee condition is related to that, so we're going to grant service connection. So that's normally how we go about granting a service connection. We have to show some sort of service incurrence. When we talk about presumptive, we talk about service incurrence being presumed based upon certain facts. So in this case, the normal situation is for Vietnam-era veterans. If you served in country, in the waters offshore, in blue water, in the airs above, all over that area during the Vietnam era, and you developed certain diseases that resulted from that, you don't have to show that they resulted from that. It's presumed that you are service-connected. And it's the same way for a lot of the toxins in Southwest Asia now. If you were there, you're presumed, and you develop one of those disabilities or diseases, you're presumed at that point to have been exposed, and as long as you develop one of those, you will be compensated for that. So hopefully that explains that. How to do, Crystal? Okay? Okay, good. Okay, Renee.
Hi, everyone. Good afternoon. It is once again my pleasure to be here and represent the North Carolina Department of Health and Human Services. Whoops, I went the wrong way. I only have a handful of updates today. I know that every time I come, I give updates on our leadership structure within the department and the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I think that many of you are familiar with our organization and understand the challenges we've had in the past couple of years with lots of turnover in key leadership positions, which is why I continue to bring this to the group. Wanted to let you know that we are very close to hiring a division director. Hopefully in the next on-site meeting in January, I'll be able to bring that person with me and introduce them to all of you, which is very exciting. We continue to recruit for the deputy director position. We also have hired, and she has started, a new assistant director for stakeholder engagement. That is the position that was previously held by Dr. Michelle Laws, who used to come to these meetings quite a bit. The new assistant director is Jennifer Mead. I know she's watching on Facebook today and wasn't able to join us in person, but I look forward to bringing her with us in January as well. The other key leadership position that we are filling is our IDD, Intellectual Developmental Disability and Traumatic Brain Injury Section Chief. And I bring that to this group because I think that that is a key partner in this space that we have not, from our division anyway, have not brought into the veteran serving space enough. And we know that we have lots of military families and veterans who are coming to our state from out of state with family members, children who have intellectual and developmental disabilities. And we need to increase our reach to those families so that they know what services and supports are available to them. Additionally, with the traumatic brain injury program that we have, we also need to expand our reach there as well. So we have a new section chief for that section starting on November 28th, and her name is Jill Rushing. She has actually been in the IDD and TBI community for many years, and we're very excited to have her on board. Wanted to quickly mention the behavioral health and IDD tailored plan implementation. That is, the tailored plans are the systems that are going to be replacing the LME MCO system for behavioral health services here in North Carolina. That was slated to go live on December 1st of this year. We have delayed implementation until April 1st, 2023. And this was really just to ensure that no members were harmed in the transition. And we keep saying that, but it's very important that people get the services that they need, that no one falls between the cracks, that everyone's doctors and therapists and medical workers are enrolled in the programs, that providers are able to get paid, and to make sure that we are able to transfer data between the various departments and sections within the tailored plans. Tailored care management for Medicaid beneficiaries will go live on December 1st, and so that is a service that helps connect people with all of their physical and mental health care. People who have been receiving services through the LME MCOs will continue to receive their services through the LME MCOs up until implementation, where they will begin receiving their services through the tailored plans. Real quick, I'm going to talk about shots. COVID-19 boosters are available for anyone over the age of 5. Again, we encourage folks to get those shots. You can, I don't have a QR code here, but we have a QR code somewhere. But you can also find at myspot.nc.gov. I'm going to mention monkeypox and flu vaccines. So we do have monkeypox vaccines available. As of October 12th, we have administered just over 13,000 monkeypox vaccines. We are updating data on our website regarding monkeypox vaccines and cases regularly. So if you're interested, I have included the website link on here. The other thing, of course, is the flu shot. I don't know that I have anything to offer other than what's been already said. I will say that early indicators are that this is going to be a rough flu season, and really, really encourage people to get their flu shots early. Wanted to make mention real quick about 988 implementation. Our division is the organization that contracts with the provider of 988 services. And I reached out to our team this week to ask how many veterans and active military members are using 988. And these were the numbers that they were able to provide to me. Now, I don't know if you can see them. I can't see them on the screen here, barely, but they are, I seem to remember between like 150 and 180 calls per month. Comparatively speaking, the calls for the general population are around 2,800 to 3,400 per month. So this is a small percentage, but an important one. The other thing that I wanted to just mention real briefly is that we have started our media campaign. It's in full force for 988 implementation. You'll start seeing billboards, you'll see Instagram, Facebook ads. We're going to do some radio. And we are looking at doing television and sort of, you know, at the beginning of the movies, when you go to the movie theater, you see a little advertisement. We're looking at doing those sorts of things in the future. This is really our phase one of our media campaign. We are targeting special populations with that media campaign, and one of the populations that we're targeting is veterans. We are collecting data on how veterans are viewing those marketing campaigns, and if you all are interested in that, I'd be happy to bring that information back when we have more. We continue to apply for and receive federal funds for 988 implementation. The big thing that we have to be aware of is that we need to have enough people to answer the phones. So as we encourage people to call, we want to make sure that there's enough trained counselors available. So we continue to apply for those funds. Super quick, from the Department of Health and Human Services, I'd be remiss not to mention that October is Breast Cancer Awareness Month, where we encourage folks to get screened and tested. And it's also Substance Use Prevention Awareness Month. And as always, a day late on this, but we had a webinar event today on substance use prevention. But I'm excited, I'm not late on this one. We are going to have a webinar event on November 17th. I think that's the right date. On suicide prevention. We're going to partner with some of our veteran and military serving organizations to do that. And once we get that flyer together, I'll send that out to this group so that as many of you can participate as possible. And I think that's all I have. I add these resources at the end just so that they're on the slides on the website. But I'll turn it over to Crystal.
Thank you, everyone, for that wonderful information. I am not going to give Victor Glover a hard time for not turning his slides in early, because this is his final day with us, and that's why I wanted to come and introduce Victor Glover. Come on up. We are going to miss you. Yes, please give us some kind words as you depart.
Oh, you don't want me to do this?
Yes, absolutely.
Well, good afternoon, everyone. Full disclosure, I do not have a QR code. But I hope that Gabby will have one in February when we reconvene. We had a lot of conferences that we've attended and had to put together a lot of information. And I thought I'd share just a little bit of that information with you. Well, first of all, in 2021, the Department of Commerce, the employers in the state of North Carolina, they only advertised a total of 24,000 jobs in 2021, coming off of COVID. To date, as of the 15th of October, our employers in the state of North Carolina have posted 25,267 jobs, and hopefully by the end of the year, we'll top 35,000 jobs for our citizens in the state of North Carolina. Dovetailing off of something that Mark said about that 40%, I know everybody was saying, well, how many vets is that? I got it right here. There are 730,357 veterans in the state of North Carolina. Now, at one time, we said there were 800,000 veterans about 5 or 6 years ago, but that number's been going down. But thanks to our legislature, our North Carolina Veterans Council, which consists of all the veteran service organizations in the state, some of them are represented here, and working with the legislators, veterans no longer are paying state tax. Hopefully we'll draw and keep some folks here in the state of North Carolina, and we'll build that number back up. So who are North Carolina veterans? Back in the day, we used to say, this is gee whiz information. Gee whiz, is that really true? Listen to this. The median age of our North Carolina veterans is 61. Most veterans are 45 or older. 41% are the ages of 45 and 64. 38% are 65 or older. 91% of North Carolina veterans are male, and 9% are female. We got this information with the UNC Chapel Hill and our labor market folks put this information together. Where do they live? We all know where the veterans live, right? Charlotte, Raleigh-Durham, Piedmont Triad, which is our Greensboro, Winston-Salem, High Point area. And then, of course, you say, well, what about Fayetteville and Jacksonville? Well, of course, Fayetteville and Jacksonville. They have a large portion of the state, but their numbers aren't as high as these three right here. A lot of organizations that come into the state start focusing in those areas. Department of Labor has directed us to start focusing in Charlotte, Raleigh, the Piedmont Triad, and added 7 other counties in the state of North Carolina that will be providing intensive services to. North Carolina Job Ready. I say this every month, so most of you probably are familiar, but I'm going to say this again. It's Governor Cooper's workforce development initiative to ensure North Carolinians are ready for jobs of today and of tomorrow. Some of you may have started receiving surveys from the state of North Carolina about the wind energy farms that we're putting out on the East Coast. Answer the survey. Answer the survey. Let us know what's going on and what you feel. The framework is built around 3 core principles: skills and education, employer leadership, and local innovation to take greater ideas and apply them statewide. Wind energy. I'm not selling wind energy. Take the survey. Also, the Governor's Job Ready initiative helped us created a North Carolina NC Works Veterans Portal that we have. And the Veterans Portal was an initiative from the Job Ready platform that the governor's office put together. We got with our IT folks, and they built a pretty good portal out there. It's veterans.ncworks.gov. It's our veterans portal. Say that every month as well, so you can always find that information. The portal incorporates veterans' military occupational specialties and helps them to figure out and find opportunities within the state of North Carolina that they're eligible for. One of our signature programs that we started in July is we partnered with the Hilton Honors, with the Hilton Corporation. They have a program that's called Hilton Honors Program for Military. What that is that they will give our veterans, transitioning service members, or the military spouse 100,000 points. They have to go onto Hilton's website, log in and sign up, and then they can work with any one of our career centers to retrieve or redeem those points from Hilton. Now, they can only be used for employment type of whatevers. But we've expanded that, and we're a little flexible on it. Job searches, hiring events, home searches. We've had folks need to use points. They've gone as far as Virginia to attend a hiring event. Some of them been hired. We've awarded points to folks in Florida who are coming to North Carolina to receive training at Seymour Johnson Air Force Base that were in the Garden Reserve. Those 1 or 2 nights help. We've provided points for folks that were doing house hunting that are coming into North Carolina and those that are departing North Carolina. So it's out there. We're trying to make a big push, Guard, Reserve, spouse, transitioning service members. And this is what I like about it. The spouse can have 100,000 points, and the service member, veteran, transitioning, can have 100,000 points. Y'all can do the simple math on that. And so it helps. And you just need to be a veteran, transitioning service member, military spouse, and a self-attestation. And that concludes the slides that they accused me of losing. But those of you that know me know I didn't lose those slides. Right, Paul? Paul, thank you. Thank you, Crystal.
Thank you so much, Victor. Victor has been a wonderful partner to the Governor's Working Group. Victor, you and your team across the state have partnered with VSOs. Without your team, we wouldn't be able to do our jobs as well. So on that, if you have any questions about anything that the co-chairs have spoken on today, go to www.milvets.nc.gov and look under Benefits and Services. You can find your local VSO. You have a county veteran service officer near you, and you could potentially have a state veteran service officer near you. So look us up. Also, if you are in the crowd or if you're watching, make sure you share the broadcast on your group pages. I just shared it to the Wilkes County Yard Sale page. Somebody might see some information that they need. So like Governor's Institute, watch it and share so that we get all of this out. Co-chairs, would you like to go to the audience now? Yes? All right. We'll let them do that. And I will introduce the National First Vice Commander, William Bill Clark, with AMVETS. Could you please come up?
Good afternoon. It's certainly my pleasure to be here representing National AMVETS. Yearly, we have Employer of the Year awards. This year, this was a unanimous selection for the work they've done. You can see evidenced by the speakers today and what was on the screen. Two areas that we at AMVETS are looking at is the African American veterans and their history in defense of our country, and also women's veterans, which it's a long time coming for their help. So I'd like to present this award now. And you may look at this award and think it's kind of small, and it is, because somebody entrusted with it, meaning nameless, dropped it. And it broke, and we couldn't get it repaired. And this is what we came up with in the interim, but it will be presented through Victor to the group as soon as we have a replacement.
That's right. I appreciate that. All right. Thank you very much.
All right. Good.
Hey. It's going to grow. All right. Thank you. Okay. First of all, thank you for acknowledging the great work that the chairs have done, and especially about what they're doing for the veterans. And that work being acknowledged for this group, the Governor's Working Group, is particularly because of the things that they do every day and making sure that the benefits that are earned are acknowledged and given. So again, thank you very much for this, and I'll have more words to say at the end of our program today. Thank you.
All right, we have a very special presentation by Vaughn Upshaw. I'm not going to say the middle name. I'm afraid I'll mess it up. Professor of the Practice Concentration Lead 4, MPH in Leadership and Practice, Public Health Leadership Program, the Gilling School of Global Public Health. Would you please come up? We are looking forward to your presentation. Mike Bressler. I am so sorry. They didn't put you on the slide. Thank you for joining us today.
It's ready to go? Thank you very much. Okay, Mike, I'll let you get started.
Okay, sounds good. All right, good afternoon, everybody. First and foremost, I want to go ahead and thank all veterans, service members, and their families for everything that you do and continue to do. Without you, nothing that we do would be possible. So thank you for that. Special thank you to David Roddenberry for giving us the space and opportunity to share some of the wonderful things that we've been working on with the Building Veteran Healthy Communities project. And thank you to Paul Cruz for his continued leadership. He's kind of the one that came up with this project that went away. There it is. He's the one that came up with this project and worked with Von Upshaw to get it going. So why building veteran healthy communities? Put these pictures up here because a few reasons. I'm going to tell you a story in a second. It also reminds me of my favorite quote. But that's me on the left-hand side. I'm a combat veteran, United States Marine Corps. That was raw. That was me just coming back from a mission. I served from 2002 to 2006. If I could talk to that young Marine today, I'd say, unfortunately, the fight's not over. There's still a lot of work to be done, and I think that's something that we all recognize here today. And the picture on the right-hand side is of myself, my wife, who has been my biggest advocate. I've almost been with her for 20 years. She's been my biggest advocate and support, and they're my two young boys. And the slide reminds me of one of my favorite quotes, which is that if you look at it, most overnight success takes a long time. And I think that's something that we can all definitely agree with. I got out of the Marine Corps in 2006, went to school at Penn State, and because of some of the veteran benefits that they were talking about today, especially the VOC rehab program, I was able to get my education paid for, which was huge because when I graduated, I was debt-free. And that being said, it wasn't until I got to the University of North Carolina and I found that community that I really started to feel like I belonged to something. And that you're going to hear the word community throughout our presentation a lot, but community is very important. That's where I found Von Upshaw, who is the professor of the practice at the Gilling School of Global Public Health. And she's a professor of the practice of the Leadership and Practice track. And at that time, she was working with Paul Cruz on this new project called Building Veteran Healthy Communities. And Mr. Cruz actually came and presented during one of my classes. And we got to talking, and then a few months later, I get a phone call from Mr. Cruz, and he says, "Would you like to be project manager of this thing?" And I said, no. No, I'm kidding. Of course I said yes, right? So now I work as a suicide prevention case manager at the Durham VA Medical Center. I also work 50% time on this project as well, and I'm also a committee member of the subcommittee on equity, health, and wellness. So next slide, we just wanted to talk about our online goals. On the left side, you'll see the Governor's Working Group, Equity and Health and Wellness Subcommittee to build, support, and strengthen communities, identify barriers and gaps, and foster collaboration to promote health and wellness for all service members, veterans, and their families in North Carolina. And with that, I'm going to shift it over to Dr. Upshaw.
Thank you, Mike. It is a real pleasure to be here today, and it is because of Paul Cruz that I'm here today. The work that we are doing in the Building Veteran Healthy Communities project is really to develop a roadmap and a toolkit that communities can use to assess and strengthen their capacity to address the social and environmental factors that contribute to the health and wellness for veterans, their families, and we're in the Durham VA region. This is a pilot project. We're also aligned with the national suicide prevention objectives to foster integration of suicide prevention values, cultural leadership, and programming, to work in coordination with all of you and the different things that we've been hearing about today, and to be a part of the National Veteran Suicide Prevention effort with multiple stakeholders involved. That stakeholder involvement is really where public health is at its best. Public health uses a framework that's referred to as a social ecological framework, and that recognizes that in the middle are individuals and their families, but we do not exist outside of that social community structure. And that social and community structure is founded with our collective interests around housing, employment, environmental, parks, recreation. It's around the collaboration that we use in order to make sure that jobs are available, to make sure that transportation is provided. And all of these things are what we refer to as upstream. They are the conditions that create health. And if we don't have those, none of us are healthy. So the work that we focus on in this project is really to try to think about how do we get ahead. Right now, most of the energy and effort that we have is referred to as tertiary prevention. This is someone who's had a risk of suicide. They may have made an attempt on their life, and we provide clinical services, emergency services, rehabilitation services. We have a lot of effort that is in that tertiary category. There's also a fair amount of effort that's put into what is secondary prevention, which is we know that someone may be vulnerable. So we have group therapy, we have counseling, we have kinds of support groups, we have educational campaigns. We've heard about many of those things today. Those are secondary prevention. This project is really focusing on that primary prevention, which is before anyone is at risk. What can we do in our communities to really look at the protective factors and risk factors that our communities have? As we've heard today, if employment is not available, that's a risk factor. And it's a risk factor for any of us. I will be at risk if I lose my job of having a mental health crisis, just as a veteran would be. So as we think about what we are doing, our focus in this building healthy veteran communities is really to understand what those upstream risks are, to make sure we're working with communities to build on their existing infrastructure, their assets, and making sure that we're creating stronger connections with the things that already exist, but also identifying where we can prioritize for those gaps. The example, Mike, that we've talked about a lot is you're working in suicide prevention right now as a counselor. And when you hear about these kind of tertiary and secondary things, that's the world in which you live. But what happens?
Well, so working as a suicide prevention case manager, I know we heard a little bit about the Veterans Crisis Line and 988. If you look at the majority of those phone calls, you can ask any suicide prevention case manager, they'll say that the majority are related to social determinants of health. They're related to things like homelessness, like unemployment, like lack of transportation, substance abuse, mental illness. We can talk about these social determinants all day long. But we, like Vaughn said, we're living within this tertiary and secondary prevention space. If we can get upstream and understand these factors, we may be able to build these healthy communities. And one thing I'd like to bring up as an example is somebody who's receiving substance use treatment. If they receive a 30-day treatment program and they get sober, where do they go after that treatment program? They go back to the same community they were before, correct? And then they have a high rate of relapse, and we wonder why. They don't have that safety net in that community to be able to stay well. So we at the Building Veteran Healthy Communities Project think that we may be able to provide some sort of a toolkit to different communities so that we can help capture those veterans and uplift them within their communities so that they can stay well.
So this project has only really started about 6 or 7 months ago, and we have 3 core teams that are working right now. The first is doing a piece to build evidence-based toolkits. What are things in communities that we know work, and how can we take that literature and turn it into something that really becomes usable for all of you? Secondly, how do we know where people are and where those social determinant assets are? How do we know what communities have what and where things are missing? So we have a second group that's doing a lot of GIS mapping using publicly available data and trying to help us look at where veterans are vis-a-vis these social determinants. And then our third group is working on partnership and networks. Many of you are people I've already given business cards to, or I've indicated you're going to get a phone call because our group is trying to get a sense of who are those different players on the ground and how are they interacting and in what ways are they interacting so that we can make sure we're connecting to the things that are already happening. We're not trying to create something new in terms of the capacity for what's already there. Our first team that's worked on literature review, in your packet electronically, we have given you the full poster. They won the poster contest at the North Carolina Public Health Association meeting last month for the work that they had done. Over 220 articles our students read. We're working on a systematic review right now. But what we have found, and what's so critically important for you all to understand, is that we know that there are things that can protect in communities veterans from having an attempt on their lives. And in that center column, you see the things that are associated with the things that the VA system does and what's out there in the larger environment, access to green space, for example. But then you see things that are listed in terms of their education, in terms of employment, in terms of social connection, in terms of having a place where they feel like they can have access to people who understand them socially in faith communities. If people have jobs and higher income, obviously these things are protective. One of the things that struck us when we put that list together, though, we highlighted with a few red stars. What did we notice, Mike?
Well, okay, so we talked a little bit about eligibility for VA services and local access to VA clinics. For the enrolled population, as we all know, the VA is the largest integrated health system within the United States. And for enrolled veterans, customer satisfaction is great. I mean, they really are getting high scores for the treatment they're getting. And the VA is able to hire doctors and providers who speak the veteran language because they've been there. I mean, they can cater specifically to veterans, which is great. And we also talked about, policies like the Mission Act, which gives veterans access to community care consults where they can get care in the community. And I mean, that depends on different criteria that I'm not going to get into, but it's really extended the reach of what the VA can do. If we also look at, like Yvonne said, these protective factors, I want you to pay close attention to what our students were able to find. The resilience within faith communities is important. Also within rural communities, the interconnectedness that they have. They may be spread out, but they still can connect with each other. And I think we can use that as leverage within our communities to better the lives of our veterans.
Yeah. Another one of the things that we're starting to begin to see in a more discriminating way are how our veterans are living across the Durham VA region. Where are they? And where are the resources that they might be needing? This map shows unemployed veterans between the ages of 18 and 64. Darker counties are where the rate of unemployment is higher. And then the little yellow dots are libraries, and the little red pins are NC Works. Thank you very much, Department of Commerce. But you can tell that these pins are not where the most unemployed veterans are. We see a high rate of people who are unemployed in those rural areas, and they're also farthest from the resources that would help them gain employment. We have a number of these kinds of maps that we're generating where we're able to look, as you were talking earlier, about veterans based on race and gender, based on their disability, other kinds of whether they have cars or don't have cars, lots of things like that that we're starting to be able to unpack. The other piece of this that I want to highlight, and we provided as part of our materials to this group today, is the utilizing GIS to build veteran healthy communities. This is a guidebook that one of our students created that's an important toolkit on ethical use of publicly available data. Because when you start pulling information from the Department of Commerce, Bureau of Labor Statistics, other kinds of things, and layering these on top of one another, particularly in rural areas, you can begin to get down to the point where you might be able to identify a particular person. And that's a danger that we want to be very careful around, and therefore, as part of our good practice, we've generated a guidebook that anyone can use who wants to do this kind of thing, and it lays out a set of specific behavioral and activity sorts of decision-making metrics to enable community partners to make best use of what is out there.
One quick thing about this slide, too, is I know that they were talking about veteran-specific social determinants of health, and they were talking about veterans' benefits. We have also generated some things that are veteran-specific, service era, that kind of thing, combat, non-combat, all that kind of stuff. So I just wanted to make sure that I brought up that we are also generating veteran-specific social determinants of health as well.
Yes, thank you, Mike. The third team is the one that's working on the network and partnership mapping, and this is just at the very beginning. We've done over, I think, 10 or 15 interviews, but we're looking at probably doing closer to 50 before we really get a good sense of what's going on. I see some people try to take some images. I will tell you that this is still very preliminary, so let's be careful about how committed we are to these different pieces. But this is, again, just an example of these people on our team beginning to get a handle on where these different players are and how do they interact with one another and how do they interact with the veterans directly or within the system more broadly. Because what we recognize is that for this to work, we really are going to have to think about a whole systems approach. And I think that the work that you all are talking about with the CVEBs this morning and the work that Veterans Bridge Home is actively involved in is a good example of understanding the need to connect these different parts of the system. So our work is really interested in trying to identify through those partners who are the folks that are setting policy, providing resources, doing kind of the strategic objectives for the work. And they're at that governing level. A lot of you in this room are in those kinds of roles. There also are people who are in that supportive band. They do technical assistance, quality assurance work. They provide evaluation and training and data collection for all these different groups. You depend on them to go and say, how many folks can we get in and what are those things doing? Again, I look at you, Paul, as someone who does a lot of that kind of support for people in community and for the folks at other levels above you. And then we have the individuals and organizations that are on the ground actually delivering those services directly to veterans, their families. They are in our communities. They're employers. They're faith leaders. They are librarians. They are many of the folks who we've already heard about as part of today's presentation. And it is collectively, how do we make sure that all of these different partners are seen as valuable within the system? You all know that they are, but we often talk about silos. How do we begin to create a little bit more communication and coordination to assure what's happening on the ground in that delivery system is aligned with what the support and the governing structures are really trying to promote? And I think this is where we're really looking to try to create something that for our toolkit for you all. Oh, sorry, Mike took me back.
Yeah, I took you back. No, I just wanted to grab your attention for one second here. Yeah, as we look at this governing, supporting, and delivering, I see a lot of people in this room that clearly care about veterans' health. I know that there's a lot of people tuning in who care about veterans' health. And this is our invitation to you. At the end, we're going to have a QR code. Yeah, you're welcome. You're welcome. We're sophisticated at UNC. So we're going to have a QR code that you can scan. And if you'd like to be involved in this project or you'd like us to reach out for more help, please do. But, thinking about this system and creating this system, we need people from every single level. And that's why this slide is important, because we're in the infancy of this project. But after this project concludes, we're still going to need to continue this mission. Because this, for me personally, is not a one and done. This is something I'd like to see continue to carry outside of the Durham catchment area and then maybe even nationally later on. But, I'm optimistic. We'll see.
Well, so to that point, what are we looking to create? With these things that we're learning and with your insights around what can work, we want to be able to do something that would be similar to when you think about like an all-American cities kind of a program. There is a lot of information out there. The question is, when we talk about those protective factors, do you know in your community which of those protective factors you have? Do you know how well those protective factors are being aligned with what veterans need? Do you know who the people are in your communities who are best able to facilitate and make those resources available? Most of us don't. So what we're trying to do is take what we know works, help create an assessment tool that every community can use and uniquely identify what is needed for them. This is not a one-size-fits-all. We understand that. Each community has its own needs, its own players, its own resources. But it would help if each community also could then look at what kinds of things work and say, oh, this might work for us, and we could do a little bit more to kind of get these things happening. That's what we're looking to create as a toolkit that would allow everybody to assess correctly for their own community what's needed, and then provide a set of really well-researched, evidence-based resources that would guide folks through the process of how they would implement or do that in their own backyards. So our goal is that if we do this well, we know it will make a difference for veterans. We also know it will make a difference for everyone who lives in those communities. Quick picture of our team. This is also growing. We are hiring some other people who will help us with transcription. But what's most important for us is for you to understand that this group of people, all of us have a 1-degree connection to a veteran member. I'm married to a Vietnam vet. We have people who are spouses of military, children of people who spent a career in the military, siblings of people who are in the military, and folks who are increasingly the folks that are coming on who are active duty right now, who are doing their master's and they are working on this project while they are currently serving. So we have really been able to use the opportunity, again, thank you, Paul Cruz, to build a much bigger set of folks who care about, understand what protective factors look like, how can we get upstream, how can we begin to build that community capacity. So I'll let Mike sum us up here.
Yeah. And regarding this slide, I think it demonstrates that we can't do anything without passion. Right. I think we need people who are at least first degree related to this project and can empathize with those who served. We did change the last slide. We got it in late, so we're not the only ones that missed a slide. Talking to you, I don't know. Anyway, so just wanted to end this with veterans are people who served in the military, and their mission was to protect us, or protect all of us in the United States. Now we changed this last part to this project will help communities so they can each in their own way support veterans and their families live meaningful and healthy lives and thrive. So that's the overall goal of this project, is to create those veteran healthy communities where veterans feel uplifted and supported so that we can ensure that they can continue to move forward. As I mentioned in the beginning, I said a little bit about like my personal journey, and I couldn't do it alone. Veterans cannot do this alone, and it's going to take the work of communities, healthy communities, to make them move forward and thrive.
So there's our QR code. And there is also an email address on this. It says healthyvets@unc.edu. We are waiting for that to be made active, but it is that is the email address that we've submitted and we know will be approved. So we very much appreciate the opportunity to be here today. Again, thank you to the Governor's Working Group and to those who made it possible for us to be here today. Mm-hmm. And Mike, thank you for being a good partner on this project. We are all indebted to the work that the veterans have done to make it possible for us to be here today. Thank you.
Thank you all.
We're going to exchange business cards because I am also working with the Governor's Challenge to Prevent Suicide and the Mayor's Challenge to Prevent Suicide. And working with, so I want to point out Lee Tabor and Jeremy Hughes that are here today. They are working together with Veterans Program that came out of Vision 19, right? Rocky Mountain Myrick. And so I think that they also would love to talk to you because they are building a map for their rural community up there in Macon County and being very successful. Carteret County also has one, and I think they could probably really use your help. I'd love to get you in touch with those folks down there. So thank you, everyone, for being with us today. Please stay around afterwards. There is the 988 number. That's Lee Tabor and her team designed that. That's Western Carolina's Veteran Purpose. They had this over 1,400 times across North Carolina. They did this billboard, so good job, guys. Just a reminder that mental health first aid classes are available. You can get in touch with me, get in touch with Dave Roddenberry, Nicole French at Veterans Bridge Home. If you have a group of individuals who would like to do mental health first aid, we have space and we have the time, and we would love to be able to get your teams trained in mental health first aid. It's an excellent class. And the Governor's Institute. Simran did tell me that I was to say that they are looking for a full-time veteran and military programs manager to support their expanding portfolio of veteran and military programs, including VSS, Veteran Support Specialist Program that Dave Roddenberry and the team from NCGWG helped to develop. Your story made me think of that. I was in that pilot group when I had the opportunity and found the opportunity to go to ECU and get my master's degree. So it's awesome. And it's because of that community I feel like that I'm where I am today. So if you're interested in working with the Governor's Institute, please go. That link is there. And you can get these slides at ncgwg.org. She mentioned the electronic material. That's where it is. It will be posted on their webpage under the meetings, and you'll just click on the date, and you'll be able to get this entire slideshow and all the information. All right, our next meeting is going to be in 2023. That's insane to say that. So January 26th. If you have anything that you would like to let us know about the Governor's Working Group, if there's something you want to see more of, less of, if you want to see us more often or less often, please let us know, because I think Dave Roddenberry is going to put a survey out there that we're going to send out to all of our folks and find out how we're doing. We want to fill these rooms back up. We want to get together and collaborate, because today was awesome collaboration. And I think that's where things happen. So, Secretary Gaskin, I know you have some closing words for us. Come on back up. And then, again, please stay around. After we are finished, we will network and we'll all introduce ourselves.
Again, Crystal, great job. Thank you. This probably concludes the formal portion. What we're going to discuss after this is how we're going to meet and how we're going to collaborate to project the things that we are doing and some of the things that we are already doing. So with that, I really want to thank you for the presentation. That was just awesome, and it brings out some of the things that we want to do. Thanks for the award for the work that those that are doing, and then thank you for your attendance. So with that, we can close out, and then we can get into the business part.
Yes. All right. Thank you. We'll see everyone next year. When we're done.